Urine is produced in the kidneys and stored in the urinary bladder. Urination is the process of emptying the bladder through the urethra that connects the urinary bladder to the external urethral orifice. There are two sphincters, or valves, that keep the urethra closed to prevent leaks: internal urethral sphincter, located at the neck of the bladder, and external urethral sphincter, located below the prostate gland and supported by the pelvic floor muscles. When the bladder is full, stretch receptors in the wall of the bladder send a signal to the spinal cord and the brain. At times when it's not appropriate to urinate, the brain sends back an inhibitory signal to keep the sphincters closed and prevent voiding. When the person wishes to urinate, this inhibition is removed. The spinal cord instructs the muscle of the bladder to contract and the sphincters to open to let urine out. Urinary incontinence is involuntary leakage of urine. There are several types of urinary incontinence in men. Stress incontinence, urine leakage while sneezing, coughing, laughing, or any activity that puts pressure on the bladder. This usually occurs because of the muscle or tissues supporting the bladder are weakened. In men, this typically happens after the prostate gland is removed for reasons such as prostate cancer. Urge incontinence, inability to hold voiding. This type is commonly caused by an overactive bladder, a condition in which muscles in the wall of the bladder contract in an uncontrollable manner. This disorder often implicates problems in the nervous system. Overflow incontinence, constant dribbling of urine. This happens when the bladder does not empty properly while voiding, making it almost always full and urine overflows. This type may be due to weakened muscles in the bladder wall or a blocked or narrowed urethra. In men, the major cause is a condition called enlarged prostate or benign prostate hyperplasia, where the abnormal growth of the prostate tissue compresses the urethra and blocks urine flow. Treatment depends on the type of incontinence and severity of symptoms. Lifestyle changes: limit fluid intake at certain times of the day, such as before bedtime or a long trip. However, fiber content in meals must be increased to prevent constipation. Cut down on caffeine, alcohol, and keep a healthy weight. Try pelvic floor muscle exercises, such as Kegel exercises, to strengthen the muscles that support the bladder. Timed voiding or bladder training therapy: plan regular trips to the bathroom at set times of the day, gradually increasing the gap between trips. Medications. Depending on the cause of incontinence, the following drugs may be prescribed: alpha blockers, 5-alpha reductase inhibitors for treatment of enlarged prostate, imipramine, antispasmodics to block bladder spasms in an overactive bladder. Surgical procedures may include implantation of an artificial sphincter performed when a weak sphincter is the cause, implementation of an artificial support for the urethra called a male sling for those who have had their prostate gland removed, and surgical procedures for treatment of enlarged prostate.